Good afternoon, welcome back to my YouTube channel. This is Saima Uk. I'm a nurse from Pakistan and from Southeast England. I'm practicing here in the UK. If you haven't met me before, I've given you my introduction. This channel provides information about UK nursing, each and everything around me, life of a nurse in the UK, NHS nurse, accommodation, visas, each and every bit we discuss on this channel. So if you haven't subscribed, what are you waiting for? And there is a bell icon also. You can press the bell icon so you don't miss any upcoming video of mine. And if you are a returning viewer, thank you so much for coming back, guys. In today's topic, we are going to talk about OET writing. Yes, you heard me right. I was delaying this video because I need some quiet time to discuss, because it's a very important topic and I don't want any disturbance around me. But I was not getting that time, so today I decided I will make this video no matter what. All right, so we are going to discuss some OET mistakes in writing. A lot of people, they do make these mistakes and they fail the OET writing only because of these mistakes. So I'm going to upload some series of OET practices, and all to practice OET, some series about OET practice test, and also we will discuss OET writing, OET reading, speaking and listening, and how you can pass your OET exam in first go. All right, so I will give you my tips and tricks to pass the exam, and also how you can avoid failing again and again. All right, there are some tips that I learned and I wrote it down in my diary. I still have my book with me, my diary with me, so I can share my practical tips with you, so you don't need to waste loads of time on the other YouTube videos or other things. You can just watch my video and excel your exam. And hopefully, I'm 100% sure, if you watch the videos of OET on this channel, you are going to pass your exam. I promise, if you take this into consideration and if you practice in my way, you can do it. And I'm 100% about this, guys. So as I said, in today's video, we are going to talk about OET writing mistakes that a lot of people make. And the first thing I'm going to discuss is assessment criteria with you, and the mistakes and their correction. All right, so the first thing we have, I will say, is appropriateness of language. So a lot of people, they use informal language while they write the letters, which is not good, and then they get lower marks in the OET writing. So we will talk about this, and also comprehension of stimulus. So what does the criteria says about the information that you include in your test and that you don't need to include in the test. This is also we will talk about spelling, punctuations, and but I'm just giving you an overview. In today's video, we will talk about only two things, and that is appropriateness of language and comprehension of stimulus. All right, if you are interested in this topic, please watch the video till the end so you don't miss anything and you pass your test in first go. So if we talk about appropriateness of language, what do you understand by this word? It means you are using the appropriate language in your letter writing. In OET writing, you just write a letter, isn't it? And in the letter writing, your punctuation, your appropriate words, your way of conveying the information is very important. So I'll give you some sentences and you need to think what is wrong with this sentence. All right, and how we can improve it. What is the correct way of saying it? What is the correct way of writing it to pass the OET writing and to get 7 band or C or B in your writing. All right, so informal writing means you are using the inappropriate words which are not formal in writing, where you need to use in writing, you need to use only formal words, because this test is like, you can, in simple ways, you can say that they are concentrating more on English grammar and academic level. So you are not doing it as general. All right, even when you do the IELTS exam, it's academic, means they are checking your grammar. If you are a professional, if you can write a letter in a formal way, not in an informal way. All right, so if I say I really appreciate your ongoing management, what is wrong in this sentence? Really, the word really, it's more informal. You need to say I greatly appreciate your efforts. All right, I greatly appreciate your ongoing management. This is the correct way of saying it. Also, if I say thanks a lot, it's not formal, guys. You need to say thank you so much. All right, or thank you for seeing him, or thank you for seeing this patient. Thank you is a more formal way instead of thanks. All right, so we need to use appropriate language in our OET writing. The second thing is, if I say I ordered some test for him, it's not correct way of saying is. You can use the passive voice, where you can say some tests were ordered for him, or some tests were ordered for him. Yeah, you need to use the passive form. It's more appropriate and it's more formal. Also, if you are telling someone, if you are writing Mr. A is alcoholic, it's not correct way of saying it. It's really bad. It's rude. It's considered to be rude. So you need to say that Mr. A's alcohol intake is excessive, or the amount of alcohol that he consume is more than usual. Yeah, you can say that. You are not going to say he's alcoholic. All right, or you can say that Mr. A's alcohol level is above the recommended level, or Mr. A's alcohol intake is excessive. All right, you're not going to say he's alcoholic. All right, so you need to write it down, guys. Write down all the things I'm saying. You need to use the appropriate language in your OET writing. Also, if you're writing about obese patient and you are saying that Mr. A is fat, is it correct? Is it really rude? It's really rude. It's not a good way to say it. You need to say, or he's obese, or he's overweight. You can say he's overweight. Mr. A is overweight, or Mr. A's weight is above his ideal weight range. You can say those things, but not he is fat or Mr. A is fat. The next thing we are going to talk about is when in the letter, when you write your first paragraph and you write like he or she, it's not appropriate. You need to write the patient or the patient names. All right, you can say Mr. Smith is blah blah blah, whatever you want to say, and or the patient. Okay, no, don't write he or she. It's not appropriate. And the first paragraph is really important. You need to have it correct, and it's important that you write the patient names or you say the patient. Okay, also the first paragraph, nurses, they make a lot of mistakes with it in this paragraph, saying that not including the information that they need to include. And when someone starts reading the letter, or your letter, they already think that something is not quite right in this letter. And the first paragraph is way too important, and make sure you make it you write it in a correct and formal way. What I mean is that in the first paragraph, you need to answer these questions: who, how, where, when. Okay, you need to write all these answers. You can say that Mr. A was admitted to the hospital 2 days ago. So we are answering who, what, why, where. Okay, we need to answer these questions. Then only the person who is reading my letter will understand what I'm trying to say. So you need to write like this. You, in the beginning, you can write Mr. A was admitted to the hospital due to what reason, and what happened afterwards, what symptoms he was displaying, and what happened, the procedure that we followed. At first we did the OBS, we did the blood test, we did the ECG. So you need to think it in a way that will show that you are following the correct order. All right, if I say I did the patient OBS, patient's observations were taken, followed by an ECG. So you need to think it how you do it in practical way. When you do it in the hospital or in the ward, how do you do it? Are you going to send the patient in the theater or in any other ward without taking the obs? So you need to think it wisely and then do it accordingly, write it accordingly. All right, so if you are sending the patient somewhere, then you need to give them the brief introduction: when, why, how long patient, when he was admitted, what happened, and what we did, and why we referring. So these are all the things you need to give a small introduction at the beginning in the first paragraph of your letter. Also, there is thing that when we use too direct language, you say that patient will be seen, he needs to be seen by a social care worker. All right, it's not right. Patient will be seen by a social worker, or he needs to be seen by a social worker. It's not appropriate. You need to say that kindly arrange an appointment for a social worker, or kindly make an appointment for a healthcare support worker. You need to think and use the appropriate language, appropriate vocabulary. So appropriateness of the language is very, very important in OET writing. I gave you some tips, and I gave some information and some words that you need to use in your writing, and you need to write it down and use it in your letter next time. The next thing we are going to talk about is comprehension of stimulus. That means what the criteria says in OET writing. We need to remember what are the things that we need to include and what are the things that we need to exclude in writing, OET writing, in letter writing. All right, so let's say that question, here is the question you need to ask yourself. You need to ask yourself, what does the reader need to know? Okay, if I'm sending a patient to the pharmacy, what does the pharmacist need to know? All right, also, if what does the pharmacist need to know? He just needs to know that about the product and about its safety for the patient, right? So the other things the pharmacist doesn't need to know. If I include something extra, if I say if the medication is not a laxative, I don't need to tell to the pharmacist that patient open bowels, or I need to tell to the patient, the pharmacist, that patient open bowel when he open the bowel. If the medication is for his constipation, then I do need to tell to the pharmacist if I'm writing a letter to the pharmacist. Okay, but I don't need to tell him that when the patient took a bath or something like that. So you need to think, if I'm referring a patient to the diabetic nurse or a dietitian, what are the things I need to include? What are the things that a diabetic nurse needs to know? She needs to know what the patient eats, and what his blood sugar levels, how often we are checking the blood sugar levels, and what is the range of the blood sugar levels. So these are the things the diabetic nurse needs to know. For the dietitian, it's different. What does patient eats, how often he eats, what his preferences for the meals. So we need to think, when we are writing the letter, what are the things we need to include in our letter. All right, so let me give you some examples. So for example, you have included all the normal vital signs and test results. Is it good? Sometimes. Yeah, so you only need to include positive examination findings. However, sometimes the reader will need to know negative finding also. For example, for an anorexic patient, the thyroid function tests are normal or negative, so that the reader needs to know. If we are referring a patient to Yeah, so if I'm referring a patient to endocrinologist, I need to include all the information about the hormonal test, all the hormonal test. If they are negative or positive, we need to tell that to him. But if the information is not related to him, if the information doesn't need to do anything with him, then we do not need to include that information in the letter for an endocrinologist. All right. Another thing I want to mention here is misunderstanding of the case notes or the task. So I would recommend, when you get your examination letter, when you get your question paper, read it 2 or 3 times so you understand the task appropriately. All right. So you need to know what you are going to write. Okay. A lot of people, a lot of students, they make this mistake. They don't understand the task, and they write the letter to a totally different healthcare professional. Yes, it happens, and it happens a lot of times. All right. So you need to know, because for example, you are writing a letter to a parent of 8 years old boy, or you're writing a letter to the parents, and you write a letter to the totally healthcare professional. You are right, you feel like you are writing to a healthcare professional, and you started writing how the injury happened. Let's say your task was to write a letter to the parents to tell them about their condition of the child, and you started writing how the I'm referring this patient to you, and how this happened, how the injury happened, how he got the fracture. Of course, parents, they know it already, and they are not the healthcare professionals. Yes, a lot of people, they make this mistake. They write the letter to a totally different reader, and you need to read the task properly. You need to understand the task, how you are going to write this letter, and to whom you are going to write this letter. This is very, very important. If you need to write to a dietitian, at the front, in the first paragraph, write it down, why I'm referring this patient, and what happened, and how it happened. But if you're writing to the parent, parents, they know what happened to the child, how he got the injury. They would know what happened, so you don't need to tell them. You just need to tell them their current condition if the task asks you to do so. All right. So I hope you find this video helpful, and if you are making these mistakes, let me know in the comment section. If this video was helpful for you, if you learned anything from this video, let me know also in the comment section. If this information was new for you, put it in the comment section, guys. I love to see your comments, and I love to answer them. Don't forget that we are going to I'm going to answer your questions in tomorrow's video. So put your questions in the comment section below, and I'll be answering them tomorrow. Yes, tomorrow is Saturday, and we are going to do that session. And for writing, in the next video, I'm going to make another video where we will discuss grammar and cohesion, and all about writing, and what are the mistakes that a lot of people make, and how you need to correct them. So that is my topic for the next video. Stay tuned for that video, and consider subscribing. Press the bell icon so you don't miss that information, so you don't miss that video. All right, guys, I'll see you soon in the next video. Till then, take care. Bye bye. You can share this video with your friends and colleagues also, who are preparing for OET, because we need to help everybody. We need to help each other to get to their they can get their dreams job. It's ticklish. All right, bye bye.